Well, welcome everybody. My name is Roxane Gardner from the Center for Medical Simulation, and we are here today for convening our book club. And the book that we have chosen to discuss is by Amy Edmondson, The Right Kind of Wrong, The Science of Failing Well.
Hi everyone, Grace Ng here, Senior Director overseeing faculty development programs at the Center for Medical Simulation. I am right now at my home in New Jersey.
Kia ora everyone, I'm Hannah Lawn. I'm a rural hospital doctor from New Zealand, but currently in Boston with the CMS team doing a fellowship.
Hi everyone, my name is Laura Gay Majerus. I'm the Assistant Director of Business Operations at the Center for Medical Simulation, and I'm joining this call from my home in Idaho.
Hello everybody, Jenny Rudolph, Director of Innovation at the Center for Medical Simulation, joining you from snowy Barnard, Vermont.
Hello, everyone. My name is James Lipshaw. I'm the Assistant Director of Instructional Design and Media at the Center for Medical Simulation, and I'm joining you from my farmhouse in Western Massachusetts.
Hi, everyone. I'm Lon Setnik. I'm an emergency physician. I practice in regional and rural hospitals in New Hampshire, where I am enjoying the beginning of mud season. And at Center for Medical Simulation, I'm the Associate Director of Clinical Programs.
Hey, everybody. I'm Chris Roussin, joining you from my house in Boston. I work at Center for Medical Simulation. I'm our Senior Director of our ALPS team, Applied Learning for Performance and Safety, and I'm a PhD organizational behaviorist.
Hello, everyone. My name is Henrique Arantes. I'm a physician from Araguari, Brazil.
Hi, everyone. My name is Cruz. I am a pediatric emergency medicine physician. I work in a busy academic center, and I am coming to you from Charlotte, North Carolina.
Good afternoon, everyone. My name is Saqib Dara. I'm an ICU doc based in Abu Dhabi, United Arab Emirates.
Hi, Melissa White, an emergency physician from Geelong, Australia, and currently one of the CMS Fellows, Boston.
Thank you. Welcome, everybody. So what I would like to do is start with some initial reactions. Whatever you'd care to share is your initial reactions to this book.
I was wowed. I have read Teaming and I've read The Fearless Organization, and I didn't actually expect that I would learn something new because I follow Amy's work so closely, and I really was quite blown away by how I think it's going to change my view of my own mistakes and understand intelligent failure better. So I was pleasantly delighted.
I am also pleasantly surprised, maybe similar to what Jenny's saying. I was like, oh, I've been reading Amy Edmondson's work for a while. As part of my PhD work, I used a lot of her previous work regarding psychological safety. So I am pleasantly surprised, maybe just even to learn from Amy that failures and mistakes aren't necessarily the same thing. And to me, that is a light bulb moment for me to get that.
I also found it quite interesting. Being medical, we often talk about that Swiss cheese model, which I know she references in the book, but the concept of the intelligent failures was really useful. And sometimes can be what holds us back when we're wanting to initiate new things, particularly in the hospital systems wide. So it was quite neat to learn that actually, because the failure might eventually bring prosperity to what you're doing.
I know I was looking forward to reading this book, and I read through it, and then about halfway through, I listened to a podcast of an interview that she gave with somebody who was in Silicon Valley. And what really came through to me was just the humanism of this issue. And then reading the rest of the book to the end, it just reinforced in my mind so many things that I can do to improve and learn better from failure.
So Rox, this was such an important book for me at this very moment. For the last, year and a half, Henrique and I have been working on kind of a case review process Henrique is working on implementing only partially successful or possibly with intelligent failure at his organization. And I've been working on it at my organization. And so I've been trying to learn about outcomes and how we think about them. And at the same time, I've been expanding my risk-taking in rock climbing, and 2 people that I climb with have been pretty badly injured over the last 6 months. And so it's just had me thinking a lot about risk, outcome, and also kind of complexity. And I feel like I've had a lot of ideas jumbling through my head, and this book has provided at least some model for kind of characterizing different moments and trying to give understanding to them. So for me, it was really transformative, and I so appreciate this being a choice for this group.
I wanted to chime in. There are a couple of different parts of the book that resonated with me for different reasons, but I wanted to share a couple because there were some parts where I think towards the end, she starts explaining about different ways that companies have gotten involved in celebrating failures. And one of those was publishing failure as a CV. Part of the CV was all the things the person had been rejected from, and it wasn't that specific thing that got me. It was the publishing things that don't work. Because as an undergrad, I was working in the lab, biolabs sciences, and doing research, and I would try to repeat experiments that I read in journal articles. And I would just sort of beat my head against the wall for weeks, not realizing that what I was doing not only wasn't novel, but it doesn't work. And I was so frustrated by the fact that there was no publication that said, like, by the way, this doesn't work. And that would have been very useful information. So I know she tied that in at the end, but there's definitely other pieces of the book that really resonated in, the perfectionism angle, but also in thinking about how constructive things that look like a failure up front are actually not necessarily, it can be reframed completely to be a success. And I loved some of those stories of, and she didn't even use all the examples that I'd heard anecdotally throughout the years, but taking something that was an abject failure and turning it into a multi-million-dollar product. Those kinds of things where you just don't, you don't necessarily see it when you're in the moment, but flipping that reframe is very powerful.
I think that's so applicable to me too, Laura. I really love how translatable this is among so many different areas of work. And I found myself reflecting on my own practices and what I do at work, but also thinking a lot about my trainees and how so many times I work with these incredible residents who do something that they perceive as a big failure. And I can see that they think that there's something in there that's useful, and I certainly can. And we're sort of stumbling through how to reframe that. So that's one of the many things I really loved about this piece.
I thought there were a number of different strategies that she presented in several of the chapters. And obviously the reframing really resonated because that's what we're talking about all the time in our courses and our instructor training courses. And it sounds so simple, but it can be really hard to accomplish within yourself. I know this book is about, in her own words, making what makes learning from failure so difficult to put into practice in our day-to-day lives and institutions we build. And the other thing that Amy presented to us was a typology of failure. And so across these 8 chapters, I'm really curious if there was one specific chapter or section that resonated with you. I know some people have mentioned some points, but I'm just wondering if anyone can share what might have resonated or touched you to the heart.
I like that she gets to the point that not all failure is good. It can be a little maddening, the idea that you should try something and just have it not go well and embrace that and love that and do that over and over again. I remember being kind of slightly almost relieved that she wrote that and that she categorized types of failure. I'm very into readiness for things and, improving your likelihood of succeeding at things. And then, failures associated with well-planned and well-thought-out efforts are different than other types of failures. We're really appreciating her use of the word experiment, experimentation and experiments. And I love planned experiments, and I love organizations that think that way. I think they're better than other organizations, and they move forward in ways that are better. They learn more as they go. And I guess just, in our organization, we're constantly thinking about learning, and she's always bringing that word learning to the concept of failure. Essentially, if you're learning something useful, then it's a useful failure. If you're kind of tracking what you're learning and paying attention to what you're learning and then using it, then it's a useful failure. And if everything is too chaotic and haphazard or poorly planned, then you're not learning all that much, except the value of basic planning. And stories can be kind of cheap in business books, but I think Amy does a really nice job using stories, and her stories are very high quality. And so I appreciated a lot of the stories and examples that she used throughout the book. I don't love a lot of pop business books. I do like what she writes. I just kind of devour it immediately. And this book was definitely no exception.
One of the things that really touched me was the part of the book where she talks about the social and emotional toll or awkwardness of worrying about failing and or having felt like you failed, and how she helps normalize that. And I think a really great example of that was kind of the origin story of the book, which I believe was an early study she did during the time she was a PhD student, which looked at reported levels of error in various units of a hospital. And her hypothesis had been that higher amounts of psychological safety would lead to lower levels of error, because people would collaborate more and share ideas and back each other up and help each other out. And when she got her data, she found that more psychological safety was correlated with higher levels of error reporting. And she so beautifully conveyed sitting at her desk, feeling ashamed of herself and upset that she'd let down her research team and she'd been so wrong in her hypothesis. And then she went and researched it some more with the help of another doctoral student, Andy Molinsky, and found out that in fact, higher levels of psychological safety led to higher levels of reporting for a good reason, which is if you're scared to report and you think you're going to be punished, you won't. And in a way, I love that story because it's launched not only her whole career in a certain way, but it's the cornerstone of the book.
When I was first thinking about, the right kind of wrong, the science of failing, I was thinking I was a little bit more narrow in my view of failure, but her definition of failure is an outcome that deviates from desired results. When I sat back and reflected on that, like there was so much failure that I could point to that, I've been involved with, and true to all of the things that she spoke about, it brought forth shame, and like I would never want to, share that with somebody. Just the notion of what that means broadened it out for me. It was such a big light bulb for me. So that I think really is going to help me sort of think going forward, more ways in which I can learn to embrace it and learn from it, and hopefully figure out ways and strategies, some of which she suggested, of not getting myself into that situation again. And the other thing that struck me, and this was in the first chapter, was the notion of something of being blameworthy to praiseworthy in this whole spectrum of the causes of fear, I guess, in being able to address, accept, and learn from your failure.
Rox, I'm hoping to promote a mildly spicy conversation around using the outcome to decide if something was a failure or not.
Okay.
And I think I think when we judge based on the outcome, we run a risk because oftentimes what gets us an outcome is the same thing we did another time that got us a different outcome. The word I've used in the literature is equivalency, meaning we can do all the normal stuff, and sometimes things go well, and sometimes things go poorly. And if we judge the moment based on the outcome, we can, I think, unfairly possibly characterize the actions and also the possibility for learning. And so I would just actually love to hear, what other people think about that. Should we be using the retrospect-oscope? When should we use the retrospect-oscope to decide whether something was a failure or not? Or what do people think about that?
A proponent of using the outcome. We really agree in lots of ways, Lon, but I'm a big proponent of using an outcome to understand if things are going well or not. So if you say, wow, we've got everything locked in, look at us, we're solid. We don't do anything different any day of the year. We don't try stuff. That's to be worried about, right? Because that's not a learning organization. And if we say we have a system where we do it the same way and we have varying outcomes, it's probably not what you're saying, but forgive me a little bit just to riff off of you. And we're not looking into that. We're not experimenting with alternative approaches based on the fact that our outcomes, aren't where we want them to be. Let's assume there's a better set of outcomes we could have. It's just useful to look at outcomes. It can be scary. I know in healthcare, we actually have trouble talking about it and have trouble, having good conversations about it. But I love using the outcome to say, should we experiment more? Should we experiment differently? Should we think more broadly? Should we think using a different set of assumptions? Look at these outcomes, they're not good enough. So anyway, what you said made me think about that.
I have a bit of a clinical, response to Lon's question. Often we walk away from a resuscitation in a cardiac arrest situation, and often the outcome may be bad for the patient, meaning death, but the resuscitation was really good. We can look back and be like, wow, we worked really well as a team, or we did this and that. And it's a bit of a juxtaposition because you're feeling quite good that we ran a really good resus as a team, but obviously from a patient and their family's point of view, it's a really bad outcome. So yeah, it's interesting that to look at defining what an outcome is.
And it's a lot easier. Hannah, I love that example. If we look at something, I don't know, like Formula One or sports or even a dance performance, if you fall on your butt when you're not supposed to in a dance performance, it doesn't matter how good it felt, how teamy everybody was, that we all did the right things just beforehand. It really matters that you land that jump and end up in the right pose. And it's easier to talk about. I mean, in your case, it might have been something about the patient. And actually, I have incredible limits talking about that stuff because it's not my expertise, even though I've been around hospitals now for a long time. But it's an interesting tension, right, between healthcare, because we're talking about life and death and sickness and health, and other industries where it's like, yeah, the pit stop wasn't fast enough in Formula One. Of course it was a failure. We didn't do the dance move correctly. Of course it was a failure. And in healthcare, we have different ways of working and talking and perceiving.
See, I find that really fascinating, Chris, because, a lot of coaches, and I've been a college sports coach, a lot of coaches who I really respect see it very differently. And in fact, Nick Saban, for example, legendary American college football coach, talks about being process-oriented and not outcome-oriented because within sports, the sample size is so small. College football teams play 12 games a year. Well, like 15 or 16 now, if you're really good. 16 data points a year when your team composition changes 25 to 50% every given year, incredibly small population. And so you have to focus on, are you doing things the right way? Because it's so inherently noisy, the data. That is actually very in line with what Hannah's saying, which is you can do everything right in the resuscitation, but healthcare is inherently very noisy because some patients were going to die when they came into the building. Like, you did everything right and it wasn't going to happen. And so in some ways, I actually think that the two systems are very similar.
Basketball, you and I both love basketball. Basketball is an interesting example because, I'm a fanatic, and I studied the Celtics very closely when Brad Stevens was coach. And, he, like all the coaches that you just mentioned, are all about run the play the way we run it. And if we get the good shot and we take the good shot, the law of averages says we will come out well over time in basketball.
Absolutely.
There's also noise in the system. Some sports are actually less, they don't talk that way the same. But interestingly, over time, I think John Calipari, if we want to go deep into NCAA basketball at this NCAA moment, he's been preaching process for a long time, but his results have been bad enough for a long enough period of time that it was time for him to go. So there are limits to that process talk as well. Just to bring it back to.
Well, I think it's really interesting because what you were talking about originally, Chris, was you're a fan of really well-designed experiments.
Yeah.
And I think that fundamentally where it stops working is where the experiment is not well designed. John Calipari, using players that you can't develop. If we look in aggregate at NCAA success rates since NIL came out, it turns out that you've got to develop people and you've got to pay them to stay where you are. And the one and done method doesn't work anymore. And so his experiment is a failure in a sense. The expected result, like the hypothesis he had, we can win a national championship, having guys who are really talented for 1 year, not really developing them, and then sending them off to the NBA, doesn't work.
Yeah. James, I love what you say. And in healthcare, if we bring it back to healthcare, if we are outcome focused, then we are going to have a defeatist vibe in the air as we're trying to learn. If we're outcome focused in a particular way. And I think what is the right language is a good open question. A lot of what I work on with my team, and Henrique as chief learning officer of a hospital works on this every day. How do we learn through challenge? That's one phrase that we use. How do we learn from difficulty? How do we learn from things that aren't optimal? We might even use the word failure sometimes. And that's very process oriented, right? What's our process for learning from things? But we do certainly hope that our outcomes get better over time. So it's a dual holding of those things.
Yeah, and I'm wondering, this all, is just sort of spinning around in my head, and it makes me really curious about Saqib, as this relates to you. I know you're very interested in medical errors and diagnostic problem solving. And so I'm really curious, what are some of your thoughts and reflections that you've had either within this conversation and or around the book?
Yeah, thank you so much, Dr. Gardner, for asking the question. Actually, I could have answered it a bit earlier in the talk to set up like a context. Because as you're all aware, some of you are aware, I'm working around how doctors think while they face uncertainty and time pressures. So basically my work is inspired by Daniel Kahneman's work, Thinking Fast and Slow. And so how that is, it's about behavioral economics, but how that applies to what doctors do in their everyday life. So I started out by that, and then I thought that I had all the answers set up till I met Jenny and then Damien, and then they opened up new vistas for my thinking. So I went into more deeper stuff with Jeff Cooper and Gary Klein's work, and some of Jenny Rudolph's works actually, which is very, very relevant to my work. But most of that stuff is basically very nut and bolts of decision making and some technical stuff. And when I ran into Amy's book, that set up the bigger context for like the overall overarching schema of how failures happen, rather than the very nut and bolt technical stuff that I have been working on for the past few months. So I find it very fascinating. It's actually very, very relevant to my work because it gives the overall scheme of how failures happen, the basic failures, complex failures that she goes into. So it gives more layers and depths to my own work that I'm doing.
I think Lon and Chris mentioned about the process learning in a learning organization. And I think if you have the lens of the becoming humble and curious, so if the outcome is not bad, we have good things and not so good things happening in our shift. And sometimes we have a very bad outcome like the death. And we had some amazing work by the teams, etc. So if we have this curious lens to analyze the failure and become humble, what Amy mentions, it's important for healthcare, and sometimes it's not easy to have this lens to analyze the failures.
And Henrique, one thing I'm very impressed with, you know, I have the honor of working with you and your team, your hospital, your medical school in Araguari, Brazil. And one of the things I'm so impressed by is the fact that you've been able to implement Circle Up in your hospital. And, you know, what that means, to describe it briefly, is just that the teams come together near the beginning of their shifts and they greet one another, they welcome one another, and they discuss where they're vulnerable and where they're ready, and they mentally rehearse some things. And it's a very quick gathering, but it's an incredible kind of warming up of the team. And you've been able to implement that almost across the entire hospital. And I believe that, you know, what I'm hearing from you is that this prepares teams to learn from things that are difficult more because they're kind of together. They've brought themselves together in that Circle Up process. What have you heard? What have you heard, maybe not to put you on the spot, but what sorts of stories are you hearing from your units that indicate that people are maybe creating psychological safety through that process and having an easier time talking about difficult things?
Yeah, thank you, Chris. It's interesting because one of our first meeting, I mentioned to you about the power distance. And what I noticed with the Circle Up is nurse technicians, and they are with nurses and physicians in the briefing during the Circle Up. So they feel like they are the same as a healthcare team, and sometimes it's not the role in a traditional hospital. And it seems helping them to speak up more frequently than in other contexts. So I think this knowing each other, supporting each other is a way to increase the psychological safety. And I hope the speaking up and the adverse event notifications, we don't have data at this moment, but I wish we can show them in 6 or 1 year, 6 months or 1 year, some results, some impact in this kind of outcome as well.
Thank you. You know, that makes me think of another customer of ours, Carillion Clinic, which is a health system in Virginia. Just wonderful people, and they invest in a learning organization, and they've been implementing Circle Up, which is how we met them and got to know them a bit. But one of the groups that we worked with was an interventional radiology group. In an interventional radiology, you have proceduralists who are, you know, the more traditional high power, high status members of the team. And then you've got technologists who are incredibly valuable, incredibly skilled, know a lot, but hold a traditionally kind of lower power. If you wanted to use the organizational science lens on it, you might say that's a lower power position. And what I've seen across interventional radiology teams in different hospitals and health systems is that there's often a situation where the technologist is not speaking up, and they're noticing something, they're not speaking up, or they don't feel comfortable talking with the proceduralist who's also doing something that's very focused and very concentrated. And so when Circle Up is implemented, or some kind of team-based system where the team has a deep timeout or check-in or warm up or checklist moment before a procedure, if you warm up the team in some way or another, you get a lot more talking and a lot more communication around things that are not going well, both beforehand, thinking about what could not go well, in the moment, thinking about what is not going well, and also afterwards, thinking about what did not go well, and just so much more learning in those teams. And I don't know why I've had the pleasure of working with interventional radiology groups in lots of different hospitals, but I have. And yeah, your comments really made me think about kind of power, status, how it influences speaking up and learning from failure, and how if we can intervene in ways that make sense, introduce mechanisms, meetings, huddles, warm-ups, then we can really influence the quality of learning from failure and learning about failure.
Right, Melissa, I was just wondering from, your vantage point in Western Australia, within your healthcare system, how does this resonate with you?
What spoke to me was the framing and normalization of, so-called error and failure. And our system is really shifting the culture from shame and blame to let's work out the system errors. And so that's the climate that I work in, and speaking up about errors and learning from them is expected. But I think the thing that resonated from what I've gotten through so far is that being able to reframe the error, particularly for my trainees when something happens, or my colleagues, and that, basic and complex, and we always talk about the Swiss cheese and lots of things had to go wrong. But if I can think about that for myself and for them in a different way, that will make a difference on the ground, and that there are errors that are intelligent failures that you wouldn't have learnt about any other way. And so I think if I can bring that to people as an understanding and try to get people to think that way, that will be a step forward.
Mm-hmm.
Roxanne, I'm just thinking of something in this very moment, and we're about 50 minutes into this book club, and we still really haven't said the word simulation. So I feel compelled to
please
reflect on simulation here. I think what really resonates with me is Amy's chapter on appreciating systems, especially she said that intelligent failures is really most powerful, or really only makes sense when the system is built in a way that it accommodates the failures and has a way to make sense of it. Otherwise, if the system is not built that way, it could become lost in the complexity of everything that's happening, lost to time, lost to people dismissing it. So I think we do have simulation, especially when we think about zone 3 simulations, where we intentionally create opportunities for people to have careful experimentation and really understand where do errors and where do failures happen in the system. We really have no reason to dismiss failures in healthcare anymore. And if there's any way that we can maximize building simulation into the system as an integral part, I feel like that's when intelligent failure really is prominent, and really where is the most important way for innovations to happen. So I don't know. I think right now in the healthcare climate, there's really still no room for failures or new ideas. I know we can appreciate the thought that failures are good. I think the reality is in most health systems that I know about, there's really very little room for failures. That's the way it is.
It makes me link this back to our earlier conversation about outcomes, because in the most simple sense of it, many perceive the undesired outcome as a failure, but really it makes me think about who is setting the outcome with all of these different layers among the system, and what is the threshold where someone's going to speak up and say, I don't think that was a failure because my sub team, my personal outcome might be different than one that's set higher up.
I think, Leah, what your comment really makes me think about, as a leader, sometimes I think about, well, let's broaden the definition of success to help us be able to know what to aim for. I think I personally really haven't thought about let's broaden the definition of failure so we can learn from it. So yeah, I think that's something that I'm going to be working on in the upcoming year or so. It's really think about and, be courageous to think about definition of success and failure.
Yeah,
Like-
Grace, that was, so well said. One of the things that triggered in my mind was Jeff Cooper being sort of at the forefront of using simulation in root cause analyses to track back and try to untangle and unpack how the error chain, how, what were some of the drivers, what were some of the factors, was it really only one thing or was it a series of things? And, I think not enough organizations are doing that sort of thing to learn from their mistakes. And I think deeper learning can be had.
There was one other part that really kind of made me think that I have a lot more blind spots than I'm aware of, which was her transparency around the privilege of failure and how that was something that was not on her radar, especially as it came to traditionally underrepresented groups or racialized groups or LGBTQ plus populations, and how kind of the story of failure as something we can all learn from brings its own sense of privilege. And I have to say, for me, that was really mind expanding because it hadn't been something that I had thought about at all. And I think she also demonstrated some vulnerability by saying it wasn't something she was thinking about. And so to me, that really resonated as something I need to think more about and be more conscious of, how my perception around the wisdom that can be gained from failure might not be the same for everybody coming into the same situation or coming out of the same situation.
That's a great takeaway. I'm wondering, as we're approaching the top of the hour, if anybody would like to share their takeaways of maybe from this conversation as well as from the book.
Well, one of the things that I am taking away was captured a bit in the final chapter of the book about being a fallible human being and how to embrace that. And I think the three things that I am taking away are: one, recognizing the opportunities of intelligent failure where I can use my skills, my formally trained skills as a researcher, to think about life hypotheses, like, what do I know if I've done my homework and I know this situation, whether it's how I am a mom or how I interact with you all, my beloved colleagues, where I can make experiments that are helpful to all of us for learning. And I think part of what I'd never thought of before is that my aversion to messing up and my aversion to feeling ashamed of myself can make me not take the necessary risks sometimes. And so I just really like the idea of thinking about basic, complex, and intelligent failures and understanding how I can avoid the former and steer toward the latter, and maybe be a even more supportive colleague by continuing to model fallibility, but not stupid fallibility, helpful fallibility.
I feel like I'm seeing such, common links between what everybody's been saying. Lon, your last comment made me think about the phrase failing upwards. And I feel like the type of person who we associate with someone who has failed upwards is not someone who's learning from those failures. They just continue making the same mistakes. It links to me with, Grace, what you were saying about redefining success, the idea that we have to set people up for success. We have to have a learning organization that sets people up for success. And when you have set someone up for success, that's actually the moment where the outcome is less important, because there is noise there, in the sense that we've set our system up to make success likely. That doesn't mean it will occur, and we can still learn from it. But that's different from a dumb failure, a badly set up experiment wherein we've set up people to fail, and then the failure, it's almost in a way so obvious, like what went wrong is so obvious that we can't learn anything from it because we already knew. Like we already knew that this was the wrong way to do it. So I'm just seeing such a link between sort of these different threads happening here.
I'm reflecting now on the tension in our organizations and in our healthcare organizations, the tension between, you know, doing well and learning, and the definitions of doing well and learning. And you know, one of the things I realized when I first came to healthcare, which was now about 10 years ago, went to Boston Children's Hospital, I realized that even in that amazing, very advanced place, that learning well on the job wasn't necessarily a universal part of high performance. The way high performance was defined in the hospital, it was more like be perfect. And if you tell people to be perfect, then there's no room for imperfection, and there's no way to introduce a process where you learn from imperfection. And that makes any discussion about learning from errors or difficulty really feel stilted and ceremonial or fake. So like an M&M meeting, not just pointing at Boston Children's, but really kind of many types of meetings that should be about learning and getting better instead feel ceremonial because of the way we define high performance. And of course, high performance should include how well we learn from failures. And so I think that's something we need to get better at.
Well, Chris, that really takes us right into the end of the book, which is, you know, how we can thrive as fallible human beings. And Grace opened up the recent instructor course with the admonition to relieve yourself of trying to be perfect. Mm-hmm. And that's one of the things I think that Amy says in this last chapter is a way to thrive, is to resist that perfectionism and that internal dialogue that can itself set you up to fail as much as it can help you succeed. I just want to say thank you to everybody for joining in and engaging in this book club. And it was really great to hear all of you express your opinions and share your thoughts. And I look forward to our next meeting.